realistic is it that your diet can actually replace your tablets? Is one more important than the other? Should you do both? Is it sensible or even safe to actually come off your tablets? Those are the questions I'm going to be answering in this video. My name is Neris Frater. I'm a GP and I help people lose weight and achieve pre-diabetes and type 2 diabetes remission. And this is something I come across all the time. People are a bit apprehensive about what they can do with their lifestyle. You've often heard lots of conflicting advice. You don't know if to go low carb, low fat, Mediterranean, is fasting good? All of these questions. And meanwhile, the doctor's putting on more and more medication. This actually is a really important video. And the first thing I want to mention is that it is a misconception that if you take your tablets, then your diabetes is in control. Although we doctors do prescribe medication to manage diabetes, all the medication does is decrease the blood sugar. It does nothing to reverse the process that's going on underneath, which is that you've got a high insulin level, you've got insulin resistance, you're likely to have a lot of inflammation in your blood, and essentially you've got a pancreas that isn't functioning well. The only way you're going to tackle all of those factors is by changing what you're eating. And you know what? It doesn't have to be an all or nothing. You either take medication or you work on your lifestyle. You should always do both. And you know what? It is true. You can come off medication. There are ways of doing it and criteria, etc., that I work through as a doctor, because there are dangers of coming off medication suddenly. But there's also a risk of your blood sugar going too low if you overhaul your diet completely, which is why I offer clinics to help people do it safely. So a tablet to decrease the blood sugar will do just that. It doesn't help you decrease your fatty liver, improve gout, decrease joint pains, improve your blood pressure. You often take multiple different medications to treat all of them, which is why I often see people with type 2 diabetes on 8, 9, 10 medications to help them manage not only the diabetes but the complications that may come from it. Did you know the chances of remission with tablets, that's having a normal blood sugar for 6 months, maintained for 6 months without medication? Did you know that the chances of remission using medication alone is less than 1 in 100 people? In fact, it's so rarely seen as a doctor. The general trend with people with type 2 diabetes is they come to see us, we give them medication, it lowers it slightly for some time, but over months or years, the blood sugar starts to creep up again, and we add another one to bring that blood sugar down again. And before you know it, you're on 4 medications. But actually, what I realised is if we help the pancreas work better by decreasing the carbs, I found that 1 in 3 people were achieving a normal blood sugar. And that was within a few months of changing the way they live. And that is so important. And these people, they don't just improve their diabetes, they improve their other health conditions as well. So it's not just diabetes medication you would expect to come off. And that brings me on to the topic of medication that decrease your weight. Some of the medications for diabetes do help by decreasing the weight, causing an improvement in blood pressure, etc. And that's amazing. However, once again, don't expect that will sort your problem. Don't believe that you can eat what you want and take a medication, because there are risks to everything. A lot of these medications are new. Yes, they've been researched and developed, but we don't know the long-term effects. We don't know if this might cause harm in 10 to 20 years' time. But we do know that eating more vegetables, healthy fats, and decreasing processed foods will have a huge impact on your health. I can't emphasize it enough. Do you know what? I was really frustrated. One of my patients told me once that they'd been diagnosed with pre-diabetes, and the GP had mentioned, oh, if only your blood sugar was a bit higher, I could give you medication. And I'm just thinking, no, pre-diabetes is such a brilliant time to get control before things get worse. I think it is a health warning, and you should use it as that, because your pancreas is struggling. It's showing signs of difficulty in keeping that blood sugar in range, but it's still going. And that's a brilliant time to really help it out. And I find people with pre-diabetes tend to be extremely motivated, and it's a golden opportunity for you to change the trajectory, because you don't want type 2 diabetes. You don't want the risk of the complications or the stress or worrying about the condition all the time. I see so many people that are anxious. If you Google complications of type 2 diabetes, it is terrifying, and I'm seeing more and more people living in fear of their condition, and this fear actually is quite paralyzing. So what's my opinion about these weight loss injections? It is a controversial topic, isn't it? Because we know, as I've already mentioned, type 2 diabetes has a lot of risks, causes a lot of damage. Being overweight increases your risks of so many conditions, and if you've got pre-existing conditions, it tends to make it worse. Plus the effect on confidence, self-esteem. It can impact every aspect of your life. So anything that you can do to decrease your weight is amazing. And that would include the weight loss injections as well, or any weight loss medication. I get that, and that is really important. However, for so many of these weight loss medications, we do not know the long-term effects, but also they're not currently licensed for very long. So what happens then? I find that quite often people will take the medication but won't think about what they can do as well. And then when you've got to stop the medication, nothing's changed. And this is why the NHS approaches it quite differently. Alongside a weight loss injection, you should be getting coaching or guidance from a dietitian or a group clinic to help you make changes, and that's how you really accelerate, because it's not really realistic to be on medication long term. Medication affects your kidneys, that will deteriorate over time. So as a long-term strategy, it doesn't seem to work. Also, things like drug shortages. We've had huge shortages of these medications, which means that people have gone without them, and they've become really quite anxious and stressed. And my biggest thing about it is that you're giving your control away. You become psychologically dependent on something else to help you lose weight. And whilst I understand it is so important for people to get started, I would want people making a longer term strategy while they're taking them. So for some people, it is absolutely the right thing to do, as is bariatric surgery. For certain people, it does work, and it does decrease people's risks of having heart attacks and strokes. But for the majority of people, I would be cautious. Do you know what I find really ironic about it? Is if you zoom out, if you were an alien looking down at planet Earth, you'd see that humans are eating fake foods. So if you think about it, pre-packaged foods, factory-made cakes and biscuits and crisps. We're eating fake foods and then using synthetic medication to counteract those bad foods. And I think that's the crux of it. And that is what I would have an issue with. These synthetic drugs may well help, but they're not the answer. The answer lies within you. It's getting control. It's taking the time to learn what it takes to decrease your weight in a sustainable way, to make changes that you know you can stick with long term, and it is totally achievable. It may well take a different strategy to what you've done before, and it may take tweaking, and it might take a long time, but it doesn't matter. As long as you're going in the right direction and that you keep going and you keep doing something, then that's the most important thing.